This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Dr. Mark Hiatt is the Executive Medical Director of Regence Blue Cross Blue Shield. Good morning, Dr. Hiatt.
Good morning.
Good to see you. We want to talk about protein a little bit and getting more protein in your diet. So a lot of people are trying to increase their protein intake. What's the best way to do that?
Well, more protein, Amanda, doesn't necessarily need to mean more meat. Of course, meat is an excellent source of high-quality protein, and here I'm talking about beef, poultry, pork, and even milk, cheese, and eggs. But another really good source are plants. And here I'm talking about things such as whole grains, beans, nuts, vegetables. Increasingly, researchers are finding that plant-based diets may actually lower the risk of certain diseases and cancers.
How frequently should we be eating protein?
Brian, not all at once, not just at one time during the day. It's better to spread out that protein intake throughout the day.
Okay.
So you shouldn't eat, your diet shouldn't be, or should it? I guess I should ask the question, should your diet be mainly protein?
I would say not, Amanda. It's important not to let protein crowd out the other important macronutrients, such as helpful carbohydrates and fat. Really here, the key to a good health is a balanced diet.
All right, let's move on now to medical care. There's a headline this morning, a fifth of medical care may be unnecessary, over-treatment by surveyed physicians. What did this survey show, doctor?
Well, Brian, about 2,100 physicians were surveyed.
Okay.
And they responded that they felt that about 21% of all Medicare was in some way unnecessary.
Why?
Well, it's thought that it could be there were actually many reasons given by these physicians who were surveyed. Foremost was actually the fear of malpractice. Secondly, pressure or requests from patients. And third was the difficulty accessing medical records.
Okay, so looking at the big picture then, what's the solution here?
The solutions given in this survey, Brian, were training medical residents on appropriateness criteria, providing easier access to health records, and developing more practice guidelines.
Wow.
Just quickly, is vaping better for you than smoking?
Amanda, I think most health experts would probably agree that given those two suboptimal choices, that vaping is actually better for you than smoking tobacco, although there are still risks pertaining to using those electronic cigarettes.
Is there a reason why vaping might be a little bit safer?
Well, you avoid the tobacco smoke associated with lung cancer and the things contained therein, such as tar and carbon monoxide.
But vaping still has its problems.
It does. It still delivers nicotine, which has its own problems, including the risk of developing heart disease and having heart attacks and strokes.
Well, we always appreciate chatting with you, Doctor. Thank you so much for coming in. This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.